coffee and hot coffee. Okay? Have the person close their eyes and see if they can smell it. All right? That's number one. Number two, you're going to test visual fields. Carlos, can you come up here so you can? So number two, we're testing visual fields. So Carlos is going to look forward. Okay, Carlos, I'm going to use a marker in your peripheral vision. You tell me what you see. Just say it. All right, so his vision is it should be like right by your ears. Okay, that's normal. All right. Number 3, 4, and 6, we actually do together. Stay there, stay there. 3, 4, and 6, I'm going to have Carlos look at the actual marker, move his eyes, but not his head. Okay? So that's ocular motor. Ocular motor. Right eye is abducens, left eye is ocular motor. Right eye is ocular motor, left eye is abducens. And then we go at an angle, it's trochlear. Any questions about that? Number 5, the patient should close their mouth and bite down. Hold their hand under the patient's chin and push upward while the patient tries to open their mouth. So I'm going to put my hand under your chin, I'm pushing up, and you try to open your mouth. Okay? Good. That's trigeminal. Okay. Number 7, have the patient perform the following. Smile. Frown. Frown. Like a sad face. Good. Wriggle your forehead. Good. Okay. Cranial nerve 9 and 10. The patient should open their mouth wide and carefully touch the back of their throat with the tongue depressor. Now you want to know if the person has a gag reflex. Yes.
Oh, no. Yeah, I do have it.
Okay. So what is a gag reflex? Exactly. Okay. They're going to bark if you actually do that. So what you can do is you can actually take the light so you can see, and you're going to take it and touch it. I'm not going to do it because he has a gag reflex. Take it, and we're going to touch the back of the pharynx. And what's going to happen is that you'll see, because when you put something in the body thinks, this is muscle back here. The body thinks that it's swallowing something, and you'll see the pharynx lift, okay, as if they're swallowing. All right? When you're done with this is contaminated. If you have any type of secretion on it, throw it in the trash can. Number 11, have the patient sit down and press firmly on their shoulders while they try to raise their shoulders. So I'm going to push down, you push up. All right, that's number 11. And then number 12, stick out the tongue and keep it as straight as possible for 15 seconds. So just stick out your tongue. Good. Now the thing about sticking out the tongue is that if there was something wrong, it would deviate. Kind of like how a dog's tongue hangs toward the side. Okay? It would deviate toward the side, either side. So that was normal. What's that? It was droopy? But it's still normal. Okay, the problem is that it's moving from side to side. Okay. B, evaluate quality of the lingual speech sound. So have the person slowly say each letter and observe the tongue movement. So you don't have to do it with the tongue sticking out. Okay. So just say the letter L.
L.
R.
R.
W.
W.
Exactly. So you're just watching the tongue. Okay. Thank you, sir. The cerebellar function test, there are 5. You're only responsible for 1. We're going to go through all 5, but on the card or on the paper where it says cerebellar function test, you're only responsible for doing 1. So you can choose which one you want to do. All right? So number 1, you're going to stand erect and move the heel of your foot down the tibia or shin of your opposite leg without falling. So what you're going to do is I'm going to take the heel of my right leg and move it down the shin of my left leg. And I'll come over so you guys can see it. Okay? So it's heel all the way down to the toe. Okay? Heel, I don't know if you see it, Jacob, sorry.
Yes.
All the way down to the toe. Okay? So you're just tracing the leg down. All right? Number 2, close your eyes. Bring your index finger of your right hand to the nose and also perform the left hand. So you're closing your eyes, not leaning on anything, and you're bringing your finger to your nose.
They do that in the DUI test.
They do. Okay, so that's number 1. Okay. Number 3, close your eyes while standing for a minute without falling or swaying. All right. So this one, we actually had a student maybe about a year ago that actually had a cerebellar lesion. Okay? And so when the student did this, the student almost fell over. Okay? So you don't know that you have it or not, right? So can you stand up for me? Oh, just do it. Right? So stand up, face them, put your hands out, both of them. Okay? Close your eyes. And what I want you to do is just support. All right? Just in case someone actually falls over. All right? Walk in a straight line for number 4. Now places the heel of one foot directly in front of the other. So what you're doing, you're looking straight, okay, and you're walking straight, and it's heel toe, heel toe. Because remember, what the cerebellum is doing is that you're getting sensory signals from your body because you're moving, and then the cerebellum has to correct those movements in order for you to stay erect. If there's something wrong with the cerebellum, meaning that someone is intoxicated, the cerebellum gets a mixed signal and it can't send out the correct motor response. Right? And so what a person does is that when they're doing this, sensory input is going to the brain, the cerebellum is supposed to tell them which muscles to contract in order to stay erect. The cerebellum can't do that. And so what they do is they do like this. Okay?
I have an argument with that.
Go ahead.
You know when they do that for the DUI, what if the girl has heels? That's not fair. And they always never let the girl take off the heels.
Yes, but then you can also do this one too.
Mm-hmm.
Okay, so there's other ones you can actually do. Number 5, place your hands on your thighs. Supinate and pronate both hands simultaneously. Supinate, pronate. Supinate, pronate. Okay? Cerebellum. And then the opposite. Okay? So it's kind of like how you pat your tummy and rub your head at the same time. That's cerebellum. Okay? So the more in sync you are, okay, the better the message is actually getting sent. Okay? See, the message is all off. Need some coffee. All right? Any questions? All right.
The cranial nerve number 8.
Speak up some for me.
The cranial nerve number 8, the